I,
we,
sorry.
we all know you, and Amy knows you too. So we're not gonna do an intro, Jen.
No, I know. That's what I'm
So you
saying.
can
So hi, everybody. This is
so you can
Jennifer.
go ahead.
Yep. I'm here to do part 2 of the breathing clinic from the Hobson Institute. And this week is all about the myofunctional therapy week around airway and myofunctional therapy. So I want to first share with you what myofunctional therapy is. Many of you may have heard of it in the dental field, and it is a training of, it's basically tongue training and mouth training. It's PT to the mouth. And the mouth is very important because it's our vital center, right? It's our center of breathing, chewing, swallowing, articulating. And we don't pay attention too much to how it functions. So what we are going to try to learn today is how the tongue and the airway work together with the rest of the body. And last week or last time we met, it was all about buteyko, which is, the volume of your breath, the breath rate, how breathing through your nose, and how sensitive we are to holding on our breath. We took a lot of different exercises, and those exercises were all around breath holding and slowing down our breath, making sure that our tongues are in the roof of our mouth and our nose is working. I hope all of you have tried your nasal sprays and your neti stick to help improve your nasal breathing. If you're using a breathe right strip or a nasal dilator, and tape for your mouth. There's a new tape called Myotape that doesn't cover the mouth. So if you're scared about taping, I've been taping for almost 10 years. It's been one of the most important things that have changed my energy level. So if you're looking for more energy, use a nasal dilator and some type of tape. And there's several on the market, but the myotape.com is one that you shouldn't be scared of because it doesn't cover the mouth. So this week, what we're going to go over is myofunctional therapy. So we're going to train how nose breathing, tongue posture, swallowing, all of that helps support the airway. And I'm going to go ahead and share my screen. Okay. Oh, wrong place. Sorry. We're going to start right. It went to the beginning. Okay. Now, so preparing our body for ultimate breathing capacity. That's what this section's about. So we're going to go over head and neck posture, proper oral posture, position of the tongue, teeth, lips, and mouth, and our ability to breathe in these postures. Okay. So this is a nice slide that brings you back to the basics, right? So you have the normal curves of our body. So think about how you're sitting right now or how you're watching this video and how these curves are positioned. And what are we doing in our workday that are outside of these curves? Okay, so believe me, I'm guilty of it because I sit and, at the head of a patient and I'm looking down and treating patients' necks and heads. So I'm not in this perfect posture, but I will tell you that I do a lot to maintain the posture so that I don't lose it or get stiff around it because of what I do in my day. This will create a proper healthy throat airway. So your neck, if your neck is a forward head, you're going to change the airway shape. So that's what we're going to talk about, is maintaining these. This is a lordotic curve. This is a kyphotic curve. Those are natural curves. And then the lower back should be a lordotic curve again. All right. So if you look at this image, you have an image of 3 people. The first one, you'll see a perfectly positioned spine and head. Here you'll notice that the weight of the head is 12 pounds loaded down on the spine. Every inch you go forward, notice how much load increase happens when you slump forward and your head's forward. Now that same head right here is weighing 32 pounds. And even further forward is 42 pounds. Not only that, notice the curve. So we've got this nice lordotic curve, kyphotic curve, lordotic. Look what happened here. You're starting to lose this. This is considered an inverted cervical spine, a straight neck. It becomes not inwardly curved like this. And if you notice, the base of the skull ends up sitting on that the first vertebra, which is the atlas. So the more forward you are, the structures in the back of the head and neck, that there's nerves back there, there's arteries that leave that area to help feed the brain and the head. You don't want to squeeze that area. So only that, notice the position of the throat. So this patient, this last image, there's a compensatory airway position that opens up the airway, just like CPR. If anybody's taken CPR recently, the first thing is open the airway. They bring the head back to create space in the throat. So that throat space also compromises the neck. So the neck is changing because as we adapt to this posture, we start closing down that throat space, and we're stuck in that posture because that's how we can breathe. If we're back here, the soft tissue in your soft palate, in your throat, in your pharynx, you end up compressing that area, and the air is not able to breathe well back there. So your body will always find a way to breathe. And that's why we end up in these positions. And guess where their tongue is? Their tongue is down. It's low. We're going to talk about tongue position very soon. But this creates a lot of tension in the head, neck, and jaw region.
Can I ask you a question?
Yeah.
For the picture, like the one on the left, with this straight position, the air was supposed to be more open?
Yes. This position means that they're functioning well here. So that means that their tongue is up. When your head goes down, theorists, when your head goes forward and you depress this part of you, your sternum, if this goes away from your chin, your tongue is connected at the hyoid to the mandible, and the hyoid's connected by the infrahyoid muscles to the sternum. So there's a pull that happens when this drops from here to here. This pulls down. So the tongue gets a retracted position, and this is what ends up happening, is that the body needs to stay in that posture to stay open. But in this position, your tongue is up. Here, they're starting to bring their tongue down, and they're probably a Malampati, maybe 3. Here, they're definitely a 4. You cannot see the airway when you open the mouth.
Okay. Thank you.
Yeah. Okay. And it's not moving. Okay, hang on. I'm going to try to screen share one more time. I got totally, sorry guys, hang on one second. View, slideshow. Okay, very technical difficulties. Okay, so here's an actual picture of a child from a journal I've read, and this is actually a picture of my daughter. And look at the similarities. This is not an adult thing. This happens very young, that the posture starts to change and the tongue starts to get low in the mouth. So notice what's happening to the neck here and the curves. So this straight neck, the jaw starts to pull back, just like when your tongue goes down because it's connected to your mandible and your sternum through your hyoid bone, the jaw gets pulled back because of the length tension ratio of these muscles that connect these bones. So you'll notice in my daughter, she has a recessed jawline here and a straight neck, and a tummy that sticks out just like this, a distended tummy, and a hyperlordotic curve here. Very narrow shoulders. This is a typical child. This is a child that is on a phone too much or an iPad too much, but we have to work on these children because the children become adults that all have breathing problems and snoring and sleep apnea problems. And some of them have snoring and sleep apnea as children. So here is just a little bit of anatomy. Notice this is the different areas of the pharynx, the nasopharynx behind your nose, the oropharynx, there's your uvula, the hypopharynx right there, and then the esophagus. So this is just basically taking away your face from the pharynx anatomy. Your septum, notice how straight that septum is. Anybody that has their tongue down has a bent nose. Anybody. And ENTs still don't truly understand that the tongue spreads the palate wide. That tongue, if it's not up on the palate, that palate starts to get narrow and you'll see a high arch. That high arch will bend this septum and cause problems breathing, normally on one side more than the other. And people don't realize it because they never really had a nose trauma, but they end up not noticing they're only breathing on one side of their nose. And that was me. I had a septum surgery about 1.5 or 2 years ago now. And I had no idea I wasn't breathing on that side. There was a bone spur blocking that nasal passage. So here's the anatomy of the tongue. This is where the tongue should rest. The entire tongue should be up on the palate. This soft palate back here is lifted by the height of the tongue here, but know that many people have a low tongue posture and they tend to clench. These are my clenchers, the ones that have a low tongue, their tongue, and you might, as a dentist, might notice more plaque buildup in their lower incisors. All of that, if they rest their tongue low in their mouth like that, they create a lot of tension in their jaw, their upper neck, and their shoulders. Notice yep.
Can I ask another question?
Yep.
Since this is a small crowd, I figured we'll do the questions as we go by. I promise won't bother you too much. The frenectomy that we've been doing, the functional frenectomy I've been doing for your patients, for adults, is the whole purpose of the myofunctional therapy is to teach them where to put their tongue before I do the frenectomy?
The prior 4 weeks is a minimum of, yes, training the tongue so that you don't have a tongue that's setting low before you release it, and make sure that it's toned and flexible. Just like if you went and had knee surgery, it's recommended to go and have pre-op knee PT just to work the knee and get things strong and flexible beforehand. You don't want a kind of a fat, lazy tongue, release it and not know where to be and how to swallow properly and not how to rest up on the palate properly. So yes.
And then the next question I have, a lot of the cases that I've been doing for you, I've been seeing the patients coming back with like really thick scar in the anterior mucosa. And a lot of these patients, like most recently, I don't want to mention their names, but most recently, I told these patients to come back and see me in about a few months to do laser release of the mucosal scar. Do you think that's necessary, or if they do their exercises, can we avoid that?
You know what? I've noticed that as well, and I don't know if the incision is big there or it had to go deep there, but that if it's open, sorry about that. I don't know how to turn that off. If the scar is open too big, I think that part will scar a little thicker. What we try to do is soften the floor of the mouth. And the floor of the mouth, when we soften it, there's a limit depending on how thick that scar is when it heals. So I know of 2 that I'm thinking of that I will reassess them, and then I'll tell them, you know what, you should go back to Ferris to see if we can release or get rid of some of the scar. What is your take on
good, because
some of the scar out? Like, would it re-scar more? That's my only fear is that.
I think the reason why I'm seeing the thick scar on the mucosa because I'm doing really dissection. I'm going too lateral to make sure I get every muscle fiber. And reason why after I do the dissection, you see the anatomy, then I have to bring the mucosa together. So I'm adding a little extra tension on the line of closure. And
Yeah.
that's the reason why I'm getting the scar. So I was like debating whether I should do Z-plasty on the mucosa just so I can get the muscles, get the fascia, make sure that I get the posterior release, and then a Z-plasty in the anterior. But I mean, easier in theory than in practicality. So right now, I'm just closing this incision. I'm telling a lot of the patients that you may have to come back for CO2 laser revision on the mucosal scar. And that's easy enough, but I would rather do it one shot instead of having to do two
I
procedures.
would ask Zoggy. I would ask Zoggy and see what,
Yeah,
because I
yeah.
think that he's the best to. I'm not sure if he uses CO2 laser though. Does he?
He does not. He does not. And on the initial surgery, I never used the CO2 laser, but because I'm seeing these patients coming back with the scar, the second revision, I'm doing it on the mucosa only with the CO2 laser.
Hmm.
But I'm gonna reach out to him and see if he can give me some tip.
Yeah, I think he would be the best to answer that.
Okay,
Yep.
thank
So
you.
no problem. This is the anatomy of the nose. People really think that the nose is here and it ends here. This is the nose. And believe me, the majority of my patients that come in for myofunctional therapy, they end up with TMJ, headaches, neck pain, jaw clicking, that type of thing. But they're not nose breathing. They end up mouth breathing. The tongue drops and the air goes in here, not filtered at all, especially now during COVID. We need to filter our air. We need to make sure that we're sterilizing it with nitric oxide that gets released. Remember all of that. This is where we're supposed to breathe. That's why it's so intricate and very, very advanced filtration system. So what we need to make sure is that when we're sleeping, that if you snore, you don't sleep on your back. If you sleep on your back, the weight of the tongue and the mouth being open will just occlude the whole airway. So side sleeping is much better. We'll be going over that in just a little bit. And when you rinse your nose, you want to rinse all of this. And that's one of the reasons when I use my nasal sprays, I breathe in and swallow. It's a natural nasal filtered water with sea salt. But you want to get any of the gunk that's stuck back here down and clean. So this is something that a lot of people don't realize. They don't clean their nose. They don't think about it. They say they have allergies. Allergies can be treated. You got to treat the nose. The more you treat the nose, the more you're going to be able to keep your tongue where it should, and it'll promote good head and neck posture. All right, so we're going to go over some of the exercises that help open up the throat, okay? So when you open your mouth, what you want to see is under the uvula. This is the Malampati score, is when you can see under the uvula. It's Malampati was a doctor and an anesthesiologist that measured how well it was, how easy it is to intubate back here. If you only see a wall of soft tissue here, it's going to be hard to get that tube in there. So you want to make sure that if you don't see your airway, and I check this every day. I brush my teeth and I open my mouth and I want to see my airway. I want to check to see if it's there. If you don't see it, you should be doing these exercises, okay? The first 4 sounds, or the 5 sounds, are all soft palate exercises. So you're going to start making weird noises in the back of your throat. If you start with the sound of a crow, caw, caw. I know it's goofy, but you make that noise to open up the back of the throat. If you notice, caw, caw. Let me see if I stop share for a second. Caw. No, it's too bright. Caw, caw, caw. So that's your airway back there under the uvula, right? And then if you say arc, unk, arc, unk, arc, unk. As goofy as that is, I do it every day. I do it when I brush my teeth. I do at least 5 to 10 of them because I'm like, I want to see my airway always. And then the back of the tongue, that's the part that gets really lazy. You want to say G, G, G. You should see my tongue go up and down. And anytime I'm really accentuating, opening up the back of the throat. Let me see what else we have. Now, you don't have to try these while we're doing this, but try them if you want. The tongues get very fat in our mouths, and Ferris, that's one of the reasons why we try to train these patients before you just release them, because if they're weak and fat and then you release them, they're just even more floppy. So the tongue point, this is the tongue point and trace, and the tongue point right, left, up on the spot. I combine these two, and let me just stop share for a second. So you stick out your tongue like a lizard. And if you see my side view, it's straight out, as pointy as possible. And you hold it there for 10 seconds, and it's 10 long seconds, and then you move right, left, back on the incisive papilla. This is a spot that our tongue should always be resting on. So it looks like this. And then you draw a line all the way back to the uvula. And you hold it there. And as I hold my tongue back there, I'm retracting my throat. I'm trying to open my throat. That's the area that gets occluded when we snore, right back there. So we want to stretch it open. So again, it's the tongue, point, waggle spot without moving the jaw. When your jaw is tied with a tongue tie, your jaw starts shifting with every tongue movement. So we want to disassociate our tongue and our jawbone. So we're out like a lizard. Up on the spot, and then draw a line all the way back. And you hold it and retract, and you hold it for 5 seconds. So these, I'm giving you the most important exercises for opening up the airway. These are the ones that I feel are the most beneficial, because you're not going to do all of them. I know you're not. Myofunctional therapy, there's so many exercises. So the cave, this one may be the most important. And for you, Ferris, this is the one that I make them hold 45 seconds multiple times, right? So the cave looks like this. If you want to try it, put your tongue tip right behind the front teeth in the end position. So you say end, then you suction up, you open, and you try to hold that. You should look like a web-like shape of your frenulum.
Mm-hmm.
And then you cluck. And the longer you hold, the better for the stretch. What does that do? When I say, yep.
This cave position is like my favorite position to get a feel for the patient, whether they're ready for surgery or not. Like every time you send me the patient, I have him do the cave. If they can hold it, like you said, for 30, 45 seconds,
Yeah.
then I know we're going to be in a good shape. And even intra-op, it reveals a lot of anatomy when they do it after I open up the mucosa. So it's very, very helpful.
Yeah.
The other positions, to be honest with you, I usually don't check them. I mean, because I'm assuming that you're gonna do it. But then, as you're talking about this, I have so many patients who are not your patients, like they haven't seen you. But even as simple as you tell them to open their mouth, and they associate their facial muscles and everything with opening their mouth, they're completely associated. It drives me crazy because you know, I know it's bad for them. It's bad for us to even see what's inside their mouth.
Yeah.
But I tried a few times to explain to the patients like how to dissociate, and they look at me like I'm crazy. You know, I mean, it just doesn't compute in their head. It really doesn't compute in their head. So I don't know what to do for these patients. Like sending them to you, they'll be like, well, I don't want to see a physical therapist, and is it gonna cost me, and that kind of thing. So I wonder what would be an easy solution for something like this.
So, you know, for these patients, like, I think they don't
I'm on.
understand, right? They don't
I'm on a
understand.
call.
They
Trying to
don't
do it
understand the
before.
whole big
But
picture.
look, Trump is.
Hold on a second. Can everybody get on mute for a moment? Anyway, um, we are actually going to be in network with Aetna and United soon. So, you know, even if they don't want to see me, they can see my therapist in network, and they're all trained in it. So that's always an option, and that's going to happen hopefully in January. We decided to expand our network so more people can get help. But Firas, it takes time and patience, and we have an hour with patients. We have 45 minutes with patients. So we educate each patient. We have a lot of models and posters and explaining the importance. This is not something they get the first time, or it takes education. And I know, and I so appreciate what you tried to do, because they need to hear it, right? They don't hear it from anybody else. And nobody hears this stuff. What I'm teaching you guys, you all know it because you're in the field, but not medical doctors don't know. The average person like kind of laughs that they snore. It's not healthy to, and they don't know that there's a whole therapy that can restore normal breathing at night and no snoring. So I don't know what to tell you. I think hopefully us being in network will help more people, because right now it's just Blue Cross and Medicare.
A quick question: are you still doing the breathing clinic? And when you do the breathing clinics in your practice, do you address these issues as well?
Yes. So that's one thing I was going to tell you. That's they get a big package, right? They would get this information in a group setting, in Zoom, and they don't have to come here to my clinic. They can do this. So anybody that you're wondering, they could even just do week 2 of the breathing clinic, but I think they still need the whole thing. But it's $50 a session to do these. And it's not that much, but they get me and they get my way of explaining it. And then my notes, it's a month. It's every month. If you have anybody, you just send me their email and I will contact them and tell them I'm setting up another breathing clinic. I do it.
Here's what I'm gonna do. I'm gonna like the curriculum that you gave us for this continuum, the 3 seminars. I really like the way you broke it down. I'm gonna ask Katie to put it into a brochure for patients. I'm just gonna give it to them and call Dr. Hobson's practice, and you can sign up for the breathing.
I think, and that's probably
I think that will probably be
the
the easiest
biggest
way for me to
package
kind of
of
like get
information.
him excited and make it really.
Oh, I've lost you. Can you hear me? You just went blank for a second.
Yeah, it's coming in and.
So no, I listen. The 3 different sessions gets everything around breathing and tongue and all that. So I think it's a great idea, and it's really, to me, if they're worried about how much it's going to cost if they come to therapy, they get all the exercises without having the cost of coming to therapy. So, okay, I'm going to keep going. Then I do this every time I brush my teeth, but at least the sounds. I highly recommend that you're doing just these few exercises, which is the sounds, the tongue point, right, left, up on the spot and draw back, the cave. And that's, if you can do that a little bit every day, and then try your best to keep your tongue on the palate, Try this for a second. Sit up tall. Do a couple clicks. Cluck. Close your mouth. Put your tongue back on the palate. Suck the air gently above the tongue so that there's no space above the tongue. Teeth are lightly resting on each other. Lips are together. Now, get your head as tall as possible, your neck, chin tucked in. Gently breathe in through your nose. And gently breathe out through your nose. You are in the best position to breathe that way. Gently breathe in. That tongue is supporting your throat now. As we slouch in our day at the computers, our tongues go down. So just know that you are compromising your airway when you do that. Now, some of the exercises I give just to relax the face. Some people have a lot of tension when they have airway issues. They're clenching to open up their airway. Try this exercise. You're going to place your tongue in the roof of your mouth, same spot. Open and close the mouth gently. 70% of opening, that's all you need, 70% of opening, back and forth. As your tongue is on the spot, that incisal papilla, it recenters your jaw. Remember, no teeth contact, just let the tongue just go open, close, or the jaw go open, close. Now you can do the same exercise and put your thumb under your chin. As you put your thumb under your chin, you open, and you resist opening for 2 seconds and then return. This helps inhibit the clenchers. So open, hold for 2 and release. Open. And notice you don't want to do this. You don't want to move your head. You want to disassociate your jaw from your head, right? So it looks like this side view. You put your thumb here. Okay, so that is how to relax your jaw. Then GOPEX. Oh my gosh, GOPEX has been in my life. I don't know if you all have heard of Sandra Kahn or Simon Wong. Simon he treats children, so it's more for children, but guess what? Adults that have never learned these good oral habits become, if they were a child that never learned it, they're an adult now. So I teach this to all my patients. And if patients just did these exercises that I'm going to go over for GOPEX, they'd be a lot healthier, and they're simple. So the click, click, close, this is just to find the oral posture, right? So you're going to find oral posture by clicking first, just to feel where the tongue's supposed to be. We also know that the end position puts our tongue in the right position. You close your mouth and gently suck the air above the tongue. Or push-ups. Put your tongue where I'm telling you and push up. Do a push-up. Press your tongue up. And release. Press it up again. So when you're learning how to put your tongue in the roof of your mouth, some of the exercises, I'll tell you, in myofunctional therapy, we do all kinds of little goofy things, but elastics. You can put an elastic on the tip of your tongue and then place it on the spot. So now you have something to hold up there, right? I also get patients, I get people from all over the country now that want breathing training, and they've been mouth breathing all their life. They're 45 and they're like this. No one would really think that's the mouth breathing look, right? It looks kind of normal. But I got him to put an elastic on the roof of their mouth, right here. And then just to hold. And for the hour that we were on Zoom together, he nose breathed the entire time, and we did a bunch of gentle breath holds and a bunch of different exercises to start working his tongue and throat. So understand that it's bad habits we get into and we don't realize it. And what we do realize is we get tired after a while. Chewing, swallowing. We talk about chewing and swallowing. We train chewing and swallowing. People do not eat properly. What this is saying is that you got to be in good posture. No one is in good posture. Nobody. And it's like astounds me, right? I look at posture all day, and the majority, it's like maybe 5% of my patients are in good posture. I teach them and they change, but from the get-go, they're not. You want to chew with your mouth closed the entire time. Some people have a hard time with that. If they're mouth breathers and they're chewing, growing up with their mouth open because they need to breathe while they chew, they're sloppy eaters. So keeping their mouth closed, creating a bolus of food, a ball of food. So many people don't know how to make a ball. They're just chewing and getting the food and swallowing kind of haphazardly. The food's all over their esophagus. What you want to do is you're going to chew, and I'm going to show you. You're going to chew. Actually, I'm going to grab one moment. Okay. This is really goofy, but it's important. If you chew an apple, you want hard, like carrots, apples. Processed foods have been a problem in our diet for a long, long time, and it's made our jaws shrink. If you haven't read the book Breath yet, or Jaws, it's awesome. You need to understand why we need to eat whole foods. But I'm gonna chew. I'm gonna show you the ball of food that I've created, and I'm gonna show you the right way to swallow, as goofy as this is. So it's in the ball in the middle. I'm gonna put my hand up. Notice my facial tension. So I don't want you know how many people do this? Each time they swallow, that just creates TMJ problems. And some of them stick out their tongue and tongue thrust. So understanding where your tongue's supposed to be, where's the starting position of your swallow? Where's the resting position of your mouth? We're a good posture. Same position. Your tongue should be here. To swallow, all you need to do is gunk. But the food can't be all over the place. It has to be like you're slam dunking the food. Not like you're just blah, So a couple ways that I train it, I have people retract their lips so their lips are out of the picture. Their tongues go up, teeth touch, and they swallow without their lips. I call this now the invisible swallow. When I do this, and I point, all you should see is a little gunk here. No craning of the neck, no pursing of the lips. So one, notice my face is completely facet, no contraction. And my tongue is just gunk. Now you can do it without lips closed or open. But I train them, I progress them so that eventually their lips are together without any tension and they swallow. So creating a ball is a big deal. Training the tongue to be able to do that and swallow without tension, that's part of myofunctional therapy. But the GOPEX program, it's simpler. It's a lot easier. Let me keep going here. And Oh, there was one more I wanted to share. So GOPEX counting, I think we might have talked about this before, but in the click, click, close, the end close, the mouth posture that you're supposed to be in at rest without talking, to practice it, because people don't know how to do it, and you can't just say do it once and that's how they do it. They have to practice. Remember, it takes 10,000 repetitions to make a new habit stick. So what I have people do is sit in good posture, and this is called GOPEX counting. So you're in good posture, your knees are at 90, your feet are planted on the floor, you're arched in your lower back. A lot of people are hunched there, so you want to arch there. And you count to 60. At every fifth count, you breathe. And you don't breathe like a big breath, it's a quiet, gentle breath. So this is what it looks like. And I do this for children and adults. And my adults haven't sat like that for it takes 3 minutes to do, and I'm not going to do it the whole time, but they've never sat that good for 3 minutes. So I'm teaching sitting posture, oral posture, because each count, every pause between each count is that oral position. And then you're only allowed to breathe every 5 numbers. So you're slowing down your breathing, and it's the most magical exercise if you can get over how goofy it is. So this is it. 1, my tongue is up here. 2, 3, and I'm not going to the next count until my back of my tongue I feel is up. 4, 5, I'm going to breathe in. 6, 7, 8. So I'm going to give you a list of all these exercises in an email, but know that if you really wanted to practice your mouth posture and you really wanted to practice spinal posture, that is the exercise. It takes 3 minutes once a day. All right, I'm going to keep going. So exercises to improve posture and reduce muscle tension. Now, I know that dentists in general have a lot of forward head posture, and the problem is it's a workplace issue because your heads have to be forward because you have to look into a small area. Now, you want to make sure that you're in a good sitting posture for part of the day. Even if you're in a bad posture at work, don't make your work posture your normal posture. Your body and brain has to feel what's good posture. So do you know where your malar bone, your cheekbone? Here's one way to check it. Your cheekbone's right here, right? Your malar bone. Put your cheekbone, get your head in a good position, go straight down. Does it intercept your sternum? Or if I was in a forward head posture, is there anything below me? No, there's no sternum there because my head is forward. Get your body under you so that your sternum is under your malar bone, your cheekbone. That's number 1. Get that part right. Then you're going to make sure you have a lower back that's in. Your lower back, if it's hunched, your tongue is going to be down. Get that lower back arched. So if you're in a chair that's like sofas, I don't love them because unless I'm really trying to sit up tall and I have a pillow there, I'm slumping. It's not a good support for your back. You want to always try, if you need help, get a lumbar support. Get a lumbar support for your desk. Get one for your car. My car has one that really comes out in the seat, so I know I'm in good posture. You want your hips to be at 90 degrees. So if you go all the way back to the back of the seat, if you're waiting for anybody at a lobby or whatever, you want to scoot your butt all the way back and then lean back. Don't let your hips come forward so that you're slumping at the lower back. Avoid leaning on your desk like this. So if I lean on my desk, I'm going to be hunching like this. Don't get your elbows on. And when I'm at my desk, I'm scooting my waist right close to my desk end so that I'm not tempted to hunch over it. Okay. Now, hang on. Flat feet. Don't crisscross applesauce. Don't cross your knee at your other knee. That twists your spine. That twists your pelvis. People wonder why their pelvis is uneven. A lot of it, women tend to be a little loose jointed. So if you twist at the pelvis always in the same position, you're going to twist it. You're going to twist those bones. Now, I know that we've gone over these exercises, Ferris, last year or 2 years ago, but this exercise is so critical for people. This foam roll, if you could just understand that when your head goes forward, you're hunched here. Many women have a dowager's hump that develops, a hump right here. And that's because they're just flexed. Guess where that hump starts? Right where the head starts to go down. So just by getting the head over the neck and doing like a little bit of a chin tuck, it's almost like you're stretching out that hump. But I do this every night. And if I don't do it every night, I get stiff and achy. So you want to just do backward bending over the foam roll. Always keep your chin slightly tucked in with your mouth closed and your tongue up. I try to get in 3 positions. She'll do 3 and then scoot down an inch. 3 more, scoot down an inch. 3 more to the base of her skull. It gets, up there. You want to try your best to extend where we hunch right here. At the end of that extension, the foam roll will slip and you will right and left massage the base of your skull. This is important to just release the tension here. This you do lengthwise. You lay on it. Just lay on it. Every day if you laid on your foam roll, it splays you out. You're no longer all compressed from gravity. Let yourself just lay. I have it. There's a TV right here. I will watch a little bit of the show, just letting my body settle, just like that. But here you'll notice you can do a bunch of different exercises. The back of the neck, you can do chin tucks there to stretch the base of your skull. You can also add a little lift. If you add a little lift, you're actually doing neck sit-ups. Because guess what? When our necks are like this, and you've been in this position before, where look at my spine. My spine is not a pretty spine. And when my neck is like that, these deep neck flexors, the ones right at the neck, at the front of the neck, right behind my esophagus, they're just hanging out. They're not active. What's really active is these muscles get really tight. But here, this is weak. So you want to activate them by doing chin tucks. Okay. Then you can do these snow angels. I love these snow angels. This, for anybody with tight shoulders, you basically go over and wrap around like that. But it will reveal any tightness in the pecs that we have from not stretching. The majority of my patients that have neck problems are all tight here. And they're like rounded. Guess what? Your neck will not go into a better position if you're tight here. So you must stretch them. This exercise, the doorway stretch, you lean forward, you do a runner stretch, you stretch your chest. Who is not stretching their chest probably has neck problems right now. So understand that if you have neck problems, your chest has to be flexible to have your neck in a good position. I like to lean and then rotate. That accentuates one side, and you would do the other side, then accentuates the other side. So these are ways to stretch open your chest. This is another way to do it. This is a stretch out strap that you can just put over and stretch out your chest. Same concept. All right. Chin tucks. All dentists should be doing this. All dentists should be doing this stretch. Remember I told you about the malar sternal bone alignment? This is what I'm talking about here. This is where you want your head to be. So when your head is forward, when your head is here, and I'm saying, okay, no, get against the corner and do this. That corrects it, it overcorrects it, it stretches it. But you have to understand that I have people do it every 2 to 3 hours when they're really wanting to change their condition. A lot of patients are clenched, headaches, clicking, popping of their jaw, and they're miserable. So they will do things to change. Pain drives people to do things. And that's why I see patients. I wish I saw more breathing patients. I see them because they are TMJ patients, but no one realizes breathing is a part of the picture. Nobody. Unless there's pain, they don't even think that they need any therapy. But the 3 exercises I give for every jaw patient that has pain, or head patient that has pain, there's 3. The doorway. Why? Because it gets the shoulders back. Remember, if my shoulders are forward, I can't get back here. My head wants to be forward. If my shoulders are back, because I'm flexible, I can be here. Right? So, and if you'll notice, if I'm slumped and I rotate, this is my end range. This is my end range. Now, if I'm here, this is my end range. This is my end range. Why? Because I'm aligning my joints. My joints are not, what you end up doing when you're out of alignment is you're twisting with load and friction in areas that shouldn't have friction. Your joints are perfectly aligned when you have those curves. When you don't have those curves, you end up wearing and tearing without an injury. People are like, why do I have C5, C6, osteophytes and limited disc space in my neck, and I'm starting to have radicular symptoms? I didn't have an injury. Well, if you keep using your body with your head slumped, you're going to end up losing space around where the nerves leave your spine. And friction will create bone growth. So you don't want bony growth. You want alignment so that there's smooth movement at the joints. All right, I'm going to keep going. All right, so this is, oh my goodness, we're almost done. Just realized what time it is. No, we have a little more time. Kate, how long was this supposed to be?
Until 7:30.
Okay, so, oh, good. I got nervous there. So neck warm up. So these are all tricks that I have given people how to stretch out quickly when you have tension. And know that if you're working at a desk all day, you got to do something to change it up because you're probably slouching. So the neck warm up, this is what it is. So I'm going to stand up and do it. Okay, so I'll do shoulder rolls, 4 of them. Okay. I try to get in good posture and then I rotate. Even if you did that twice. If you did that every hour, your neck would be much better. Just those 2 things, shoulder rolls and neck rotation, but in a lifted sternum position, right? Why? Because we're getting out of our slump and we're getting out of using our neck in the wrong position. But to add to that, I like to put my arm behind me. I lean over. I stretch out my upper trap. This area is an area I do a lot of dry needling for a lot of people with headaches. I'm here.
Jennifer, how long do you hold the position?
Stretching should be 30 seconds at each position at least, really to make a good length of that muscle. So you're going to be there. And as I hold, I'm actively lowering my elbow. My elbow's behind my back, but I'm lowering my elbow. And then I'll do a chin up, which will get some of my scalings here. Chin up, like all of this. If you're sitting at a chair, you can also just hold the edge of a chair. Like that's one way to do it. You can hold the edge of a chair, and you should feel that nice stretch of the front of your neck a little bit, connecting to your collarbone. And then look to the opposite foot. Look down now. And either you're sitting or your arms behind you, and I'm pulling on the bottom of that chair and looking down. You need to stretch your neck out. Do the other side. So you're gonna ear to shoulder. If you want to put your arm behind you, elbow down, or if you have a chair, you can just grab the bottom of the chair and lean away. 30 seconds. And then what I want you to do is chin up towards the ceiling. You should feel a nice pull right here in the front. Now, if you have your arm behind you, bring that elbow down actively as you hold it. 30 seconds, and then chin down to the opposite foot, elbow pulling down, and that one gets more of the levator scapula and parts of the upper trap. So then what do? Get back to work in that alignment. Get up, try to be as straight as possible. Get your waist real close to the desk. And there you go. Now, I'm going to keep going. This one I like to do right before I take a walk. But this one you can do at any point. This is called a chicken wing reset. Your thumbs are on your armpits. And notice my upper traps are kind of high right now. I want to lift them and tuck them down, right? I want to get my shoulders so that I'm not hiking up here. So, and notice my arms are straight. And I'm breathing with my tongue up. I breathe twice. So I'm basically trying to get my sternum lifted, and then I hold my armpits. My elbows are out. So I'm going from here to here. Notice my head posture changes. Just by that, by lifting this, your head posture changes. Breathe in, breathe out, lower, and then thumbs down, hands on your thighs. But you should be in a better posture just from that. So that's quick. You do it, boom, breathe in, shoulders back, breathe in and out, lower, and then you're ready to walk. So if you want to work on improving your posture quickly, that's a good one to do. All right. Core. Super important to do core exercises. This is like, I teach, head and neck stabilization, but if you don't have a good solid core, it doesn't really stick. So I like to do side planks. You can only do if your shoulders are okay. If your shoulder has any kind of pain when you bear weight to it, chances are you need some physical therapy. Maybe you need a surgeon. I don't know, but you want 2 minutes on either side. That's when you know you're strong. And notice she's in good alignment here, but you don't want to collapse in this area. You want to keep your spine straight. And in this area, a lot of people kind of scrunch their shoulders together towards their ears. You need a long neck. A long neck will create the right alignment for your spine. So this is another reminder to use your tape. Please, please, please consider using micropore tape or the Myo tape that I spoke about. The Somnifix is another tape that we talked about that had the little vent. This, I just remind people because this is like, I always add to my previous breathing clinic and I keep reminding them of the things that we need to do. Now, sleeping we could spend a lot of time on, right? You want to know that poor sleep affects how productive you are, Sleep arouses interrupt your quality of sleep, your deep sleep. Cell phones, late night watching TV is not good for, EMFs, all those screens, it's not good for your brain. Let me go back actually. This position, I was at a hotel here, so this is not my complete setup at home, but know that I use pillows like crazy. This pillow is folded in half so that my hips and my knees are in the same alignment, right? But at home, I have a body pillow that I fold in half that my ankles are even higher. And I'll show you another picture soon of that. I always hug a pillow. I don't want my elbow to be collapsed in front of me this much. You want your shoulder as close to loose pack position, which is the position of least tension in the shoulder at rest. That's about 20 degrees abduction and flexion. So this needs a little more lift and it would be there. This is just a medium-sized pillow and I'm on my side, I'm taped and I've got to breathe right on. So sleeping tips. You want to set your alarm before bed and so you don't return to your cell phone. You want to set your alarm that says, okay, no more cell phone. Get into a stretching routine. I would highly recommend that you get into a stretching routine that relaxes your back, just like the foam rolls that we were doing in the neck stretches. Take a shower, keep off the screens for at least an hour before bed. This is me right after nasal septum surgery. I had a little bit of a lift. Know that these wedges are awesome if you have a cold, if you can't breathe well because you're congested. Elevating your head is really important to help you breathe better. Sleep on your side with a medium-sized pillow here between your shoulder and your neck. All you want to do is fill this space. You don't want it to be too big that the space makes your head go tilt. You want a straight spine from the neck to the tailbone. Use a long pillow. This is my long body pillow that I fold in half. I fold it in half. That way my knees, my hips, and my ankles are all in the same line. And you want, see these two pillows? These are two big pillows. In fact, I have now like a decorative pillow under a pillow that I put my arm because I need it even higher. Having your arm like this takes the tension off here. It is, and I don't move. A lot of people are like, oh, well, I'm turned and the way that I have my position set, I'm so comfortable, I do not move. What I do is ask my husband to switch with me every 3 months. So I'm on one side of the bed and then I switch so I don't plaster one side of my body my whole life. So let's see. That wedge is, and you can get these wedges for about $100 and they're so worth having just when you're sick. You know, like it depends on who's sick for the night and you can wash the cover and it's perfect. My kids use it. My husband uses it. So what is important to do when you have an uncomfortable blocked nose? You know, we talked about this last time. We did a lot of steps last time. Do you remember walking and holding our breath? Making sure your nose is working before bed is critical. I always do my sea salt rinses before bed, always. And if I'm really plugged, you can do 10 steps and be unplugged in a second. And remember, the steps are, I'm gonna walk. Hold on a second. Here we go. Okay, so my mouth is closed, I'm walking. I breathe in, I breathe out. I let everything out, I plug. So I'm basically holding my breath, holding my breath, holding my breath. And when I need to breathe, all that accumulated CO2 unplugs my nose. And then you nose breathe afterwards and at least you do 5. that unplugs your nose. And people that say, oh, I have allergies, I'm gonna, you know, I can't breathe through my nose. You have to work it. You have to try to change that. So I will always rinse, and I like my neti stick that makes that smelly, you know, eucalyptus smell. It keeps it open. I use my Breathe Right strips or any other nasal dilator, and I tape. Very important to keep these habits going. And people ask me, oh, how long will I need to do it? I will do it the rest of my life. I even had nose surgery. It's still, I grew narrow. Like I grew just like many people with bicuspid extractions, that you're narrowed in the face, you're narrowed in the nose. Even if I had it open, I want to make sure that I breathe well. At night, it'll make you younger. If you can really restore all your energy and all the memories that you've had of the day, you store them in your brain when you sleep well. If you snore, if you have sleep apnea, you are not going to be sleeping well, and you're not going to have a good night rest. And you're going to be not very productive. All right. And if you can't breathe through your nose for 1 minute, you've got to see an ENT. You must see an ENT. So that is it for the exercises. I'm going to stop share. So is there any questions anybody has around exercises around the throat, tongue, or spine that can keep you healthy? Anybody have any questions?
You're going to send us a list of the exercises, right?
Yeah. And Virus, there's many exercises, but I'm giving you what I think is, if you could just do these, you'd stay in good head and neck health and airway health. So I'm not trying, you know, you could do exercises forever, but I'm trying to be very concise and give you just the ones that I think if you just did this.
Yeah. Well, to be practical about it, do you think it's better to pick like less number of exercises and do them all the time, or do more exercises and do them like maybe twice a week?
I think more every day. Like the ideal thing is
less every day.
Less of total exercises. Like
Correct.
People come back to my office and they say, oh, I'm not feeling better. I'm like, okay, so have you just done the 3 that I gave you? The 3. Because if you give too many, people stop doing everything.
Right.
So doorway, chin tucks, tongue up, open, close. That resets your head and neck. That realigns everything so that you're not a car off, you know, with the axle being a little off.
Yeah.
Then if you could just do that one, and then keep remembering to close your mouth and keep your tongue in the roof of your mouth.
Yep.
So and then to me, the GOPEX counting, like if you wanted to really work on posture and tongue position, I would just do that once a day. You know, it just depends. But my dentists tend to need more neck stretching. So like for you, if you feel like you're always looking down and your body's starting to just start to lower itself, the doorway and the chin, even if you did one and a couple of these, you'd get back. What happens is that your body stiffens. As we get older, we're losing that juiciness between our joints. And when if you get dehydrated in your joints, it just stiffens. So I just don't ever want to lose that full range between the end of one side of the joint and the end of the other. What we end up doing is staying in one position, and it doesn't move from that position. Mm-hmm. So you're getting good workout in your legs, Firas. It's the upper quarter that is not, because I don't know how much you're upright when you're running. Like, I don't know how much you're
not very good.
Yeah. So
not very good. I have a lot of bad habits.
Yeah.
And but I work on them, you know.
little by little. And what I'm trying to show you is a few things and concepts that you have to understand. Craniovertebral angle, you have to have the right angle or else you have tension in your neck, right? You'll have tension in your neck just from not having a lordotic curve. And that's tension that you're creating because a lot of people don't know that they're out of alignment, but once they do, if you give them the tools, it's their choice to do them or not.
Yeah.
So
Very cool.
Alyssa, do you have any questions? Oh, I can't hear you real quick.
We can't hear you.
Oh shoot, we still can't hear you.
Can you hear me?
Now we can.
Now you can hear you, yeah.
About a month ago, I was talking with some of our assistants about wanting to implement like stretching during the day. I mean, I know it's tough with busy schedules, but I don't know. I'm just thinking about maybe some things that we can do to just kind of help everybody loosen up throughout the day.
Yes, yes, yes. I love that idea. And you know, one of the things, the door frames, you have any place that just opens, that you will be so shocked. All my patients are, when I start doing this hold up position and lean, they're like, oh my gosh. And a lot of them can't get past the door frame.
Mm-hmm.
You want to be way past the door frame to have flexible arms, but that one, those two, I think doorway and chin tucks would really change a lot of the alignment in your staff.
Yeah, I think even if we just try to do it like when they're taking their breaks on Thursdays and Fridays, which are like super long days, or before lunch, before after lunch, just taking like 3 minutes to do some exercises.
Yeah.
Might help. I also wanted to ask you, instead of a foam roller, do you have any experience with these like big Pilates and yoga wheels? I don't know if you've seen those at all.
A wheel or a ball?
It's a wheel. Do you want me to grab it?
Yeah, grab it real quick.
I'll be right back.
Doc, I remember when I used to assist with you sometimes, you would like tell me to watch my posture or to like loosen up, and like just someone else pointing it out, I'd be like, oh wow, yeah, my shoulders were all the way up here and I had my neck like this. And you don't realize, especially working in the dental field.
Absolutely. I see it all the time. Like even the assistant who've been working with me for a while, every once in a while I'm like, give him a little nudge, just straighten up, because it's so easy to get into it like this. So easy.
Yep.
And I will say, Doc, I feel like you're very good at pointing out to the assistants, like even we have a couple new assistants, and like the senior assistants remind them all the time, like, watch your posture. And it makes me recenter my focus too, to be like, oh yeah, like watch my posture too. Yeah, so these come in like a set of 3.
Oh no.
They were recommended to me by a periodontist who I was talking to, who she has gone through physical therapy for her neck and back. And she was like, oh, they're great to stretch on. So it's like 3 different sizes that give different pressures. So like this is the biggest one.
Where would you put that?
So you keep it on the floor, and then you basically like align your spine with this.
Where you roll back on it.
Mm-hmm. So this is like aligned with your spine, and then you're rolling like the spine.
Yeah.
So it almost puts you in like a back bend position.
Yeah, back extension is what we lack. Extension, I think that's great. I think the foam roll is similar to that. The only reason I like the foam roll for my back is because you can go one segment at a time. You do 3 reps at that one particular segment. You scoot down an inch, which is basically the size of a joint length.
Oh yeah.
So that is a good overall stretch, which I think is great. But the foam roll I like just because it's segmental. But I think that would be great. Any extension is good.
Yeah. Because I feel like I just need to remind myself to use these every night. Because when I do, like you can feel like all that tension in the chest and back like being released.
Yep.
So I recommend these for sure.
Yes. Awesome.
Cool.
Awesome. No, but listen, it's been a pleasure working with your staff, and Firas, you're awesome. I'm so glad we met. And you know what? It's all about educating our patients to be healthier. They don't realize that the average person doesn't realize how out of alignment they are, and that's what PTs do. So this is my pleasure to always share with you what I've learned, and I hope that whoever's listening know that PTs are always good to make sure that you are using your body the best. And what I try to do is optimize people's bodies wherever they are in their life, and to improve their breathing, their spine, their joint mechanics, their body postures from work. It's really important to stay healthy, or else you end up wearing down your joints and needing surgeries that you can avoid, really. So stay active, get a Fitbit if you're not moving, so you're doing at least 10,000 steps. Keep these simple stretches going in your life. Know that your jaw needs relaxed position. You just shouldn't be clenched, and if you are clenched, try the exercises that relax your jaw. And if you get your head over your body, over your neck, over your spine, there'll be less tension all around here, and you won't have as many headaches. So
Yeah. I agree with everything you said, 100%. And if you need somebody to hand hold you a little bit, Jennifer is the person to go to. I was a patient of hers, so
I know
I
you
know that
are a
for
good
a fact.
patient.
I need to go back and see you again.
When COVID gets better, maybe.
Yeah, exactly. Once we get the vaccine, hopefully soon.
Yes.
All right, very good. Thank you so much, Jennifer. As always, that was awesome. I appreciate the knowledge and the tips and the information. That was great. And until next time, when is next time, Katie?
Yeah, our next meeting is going to be Tuesday, December 8th at the same time, so 6 p.m. to 7:30.
Wonderful.
Very good. So we'll
Thank
see you
you
all then.
so much.
Have a good night,
Thank you,
everybody.
everyone.
Thank
Bye-bye.
you.
Bye. Thank you.